Good afternoon, Scurry County. It's Dan Hicks, your county judge here in Scurry County. Going to go over your daily numbers and give you some more information that I can. So the question has come up: can we change the way it's reported as far as positive cases that we have? I don't think that we can change that we have had positives. I'm not seeing any community. I'm not seeing any state that is saying anything different other than they're showing the recovereds. And so what we're going to do is start talking about the recovereds or adding the recovered numbers in there. So let me kind of show you what I'm talking about. So in Texas, we've had 13,790 tests. Reported is 27,054 cases. We've had 732 fatalities in Texas. Recovered is 12,507 of those. Of those reported cases. In the hospital is still 1,702. That seems to have gone up a little bit in the state of Texas. Counties reporting is 207. Okay, so in Scurry County, we've had 177 tested. We have 20 that are pending. We have 2 that have recovered, and we have 0 active cases. So that's how I'm going to start doing this from now on. I'm going to tell you how many we've had recovered and how many active cases we have, and how many cases we've had in our community. So, and that's why I'm telling you that way. So there are no active cases and there are 2 recovered. Okay, so talk about a little bit about the Open Texas order that came out yesterday. So there's some things in there that have to be adopted. On page 21 of this order, I believe it is, checklist for all employers, and then that goes into page 22 and 23. These are some things that the employers are going to have to ask their employees, and this is for every business that's open in Scurry County. So you have to screen, or not just Scurry County, in the state of Texas. You have to screen every employee before they come into your business. You have to send them home if they have a cough, shortness of breath, difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, loss of taste or smell, diarrhea, feeling feverish or a measured temperature greater or equal to 100 degrees, 0.0, that's important in there, known close contact with a person who is lab confirmed to have COVID-19. All right, so recently the CDC upgraded some of the symptoms that are required in there also, and those are listed in here as well, I think. If not, we can double check and find out, but I think those are all the ones that are listed by the CDC as far as updated list of symptoms. You don't allow the employee with new or worsening signs or symptoms listed above, and they can't return to work. And in the case of an employee who is diagnosed with COVID-19, at least 3 days have passed since recovery. That's no fever without the use of fever-reducing medicine. So 3 days, 72 hours without a fever, without using any kind of medication. And they've improved, the individual has improvement in respiratory symptoms, and at least 7 days have passed since the symptoms have first appeared. In the case of an employee who has symptoms that could be COVID-19 and does not get evaluated by a medical professional, the individual is assumed to have COVID-19. It's just like what we've been talking about all along. Assume everybody has it. But in this case, if they have had symptoms, you're going to assume that they had COVID-19 and suggest that they get tested. And the individual may not return to work until they've completed the same step criteria listed above. If they have symptoms that could be COVID-19 and want to return to work before completing the above self-isolation period, they must receive medical professionals' note clearing the individual for return based on an alternative diagnosis. So if they want to return to work, they have to give doctor's notes that says that they don't have COVID-19. There's a whole list of them here. That's going to be located on our Facebook page. We'll put it on our web page. It's going to be on the Scurry COVID page, and it's going to be on the WTC, City of Snyder, emergency management page. We've got that everywhere, and those are requirements. There are minimum health protocols for every business that is open in Scurry County and across the state. You can also go to dshs.state.tx.us/coronavirus/open Texas and get information there. So yesterday, the county's order was voted on to expire. So our county's stay-home order has expired. The state's order is still in effect until April 30th, which is tomorrow. The new order, this Open Texas order, goes into effect Friday, May 1st. And what that means for us is that I've sent in the information to DSHS to allow us to go to 50% capacity in the restaurants and those businesses that are allowed to be open. I have not received anything back from the state saying anything about that, but I'm hoping to get that information soon. It looks like we're going to be able to do that based on everything that we have already had in place is what they've asked for. There's a list of 8 different things that we're required to have in place before we can go to that. We have it all. It's taken care of. We were trying to be ahead of the game on everything, and we were ahead of the game on that. So that's taken care of. There are certain things that will kick us back to 25%. If we get to 50% and we don't qualify anymore, it's 5 consecutive testing tracking intervals with positivity rate greater than 12% in that interval. That's not a good thing if we get 5 consecutive tests that are positive. County has more than 3 positive cases per 1,000. Less than 15% of the surge capacity in hospitals for the catchment area is available. So right now we're in good shape. With the testing that was done today out there, there weren't a lot of tests, but what they were finding out is that there was about 4% of those that were tested in other counties were positive tests. So if we had 50 people out there get tested, that would only be two people that would show a positive according to the data that's out there. Don't know that what our results are going to be. We're not going to know for a few days. I'm very positive that we're going to end up in the situation where we can remain at the 50% open on all of these businesses. So that's pretty much all I have for right now. That's information that you can find on our website and on our Facebook page, the Scurry COVID page. And there's information that Cogdal's going to need from all of these businesses. And I'll get that out to you tomorrow on exactly what they have. I'll try to get Kathy to come back and sit down with me, and we'll talk about all of that tomorrow. So you all have a great day, and I will see you tomorrow.